Type 1 diabetes is a very specific thing. It affects about 10% of the total diabetic population. It has to do with an immune reaction with the beta cells in the pancreas, where they no longer produce insulin like they're supposed to. Now, there's a lot of theories about what causes it, but we don't really know what's causing it. Some of the theories are that there's like a virus that begins to affect the beta cells in the pancreas, and that messes it up, or there's an immune reaction with the beta cells in the pancreas and that messes it up. Some people have linked, studies have linked the consumption of cow protein, meaning from milk and dairy and stuff, that causes an autoimmune reaction in the pancreas and shuts down the body's ability to produce insulin. For those people, they typically either need to find the root cause of it. It is either you know, a viral thing or an immune reaction, or it's a genetic thing where those things just aren't working right. But bottom line is, those people typically, if they don't find the root cause, they need to be on insulin. And it's a great thing insulin is here. You know, modern medicine has a lot of great tools. That's one of them.
Yes.
If you need insulin, you need to be on it. And then do healthy things with your lifestyle to keep the level of insulin you need at a minimum. Okay?
Yes.
Just like a person with type 2 diabetes. And again, type 2 diabetes is typically caused by our lifestyle, our dietary habits, etc. That's why I brought up sugar, because basically the way that works is that the insulin that our body naturally produces is not enough to handle the amount of sugar we're taking into our body, so that we essentially, insulin, let me explain that. Insulin is designed to take sugar out of the bloodstream and bring it into the cells. But, you know, if we don't have enough insulin there, then our blood sugar stays high, and if that stays high, it causes all kinds of other problems inside the body, mainly inflammation, and, you know, you can go into a diabetic coma or all kinds of problems. Blood sugar needs to be managed at a very balanced rate. If it stays high like this, it causes huge problems in the body, neuropathies, all kinds of things that you know that diabetics tend to get.
Yes.
So it's a major culprit in terms of the onset of type 2 diabetes.
Wow, that's something. Neuropathy, when does that set in? Is that? Well,
neuropathy, it's an outcome of global inflammation that's created by high levels of insulin, high levels of sugar in the body. So it's just one of the many side effects or biological damage that's caused by a continued chronic level of high levels of blood sugar in the body. So.
Now, what can a person do to prevent that sugar overload?